So our next intervention is going to come all the way from Brazil, and it's going to be a video intervention as he couldn't make it here. And I would like to invite you to watch a 10-minute speech by Carué Contreiras. He is a pediatrician and he's leading the transgender and adolescent clinic at the São Paulo HIV Treatment Reference Center. And he'll be speaking about how to expand access to SRHR services for transgender adolescents.
Good morning, I'm Carué. I'm from São Paulo, Brazil, and I'll be talking about transgender and gender diverse adolescents, mitigating barriers to access to healthcare. First, why should we talk about transgender and gender diverse adolescents? Well, first, they are not rare. In Brazil, there's a recent survey, stating that 2% of population is transgender or gender diverse. There are different surveys, different places, different results, but we have been noting a sharp increase of trans-identified young people. They have been formally denied healthcare, and things may get worse since they have been put in the center of the new cultural wars on gender and sex in many places. And there is a strong association with HIV and AIDS. This is HIV prevalence by group in Brazil. We can see that transgender women are by far the most affected group, 31% of prevalence. And this is the 10 years evolution of AIDS cases by age. And we can see that only 2 age groups where there has been an increase of cases are adolescents and younger adults. What are the standards of care for transgender and gender diverse adolescents? There are psychosocial interventions that aim to allow exploration of gender identity and create an affirmative and supportive environment. Puberty suppression, that means block the natural puberty with hormones called GnRH analogs that may be made from the onset of puberty, and these aim to allow more time for identity exploration while avoiding irreversible physical changes from natural puberty. Gender-affirming hormonal therapy, it's testosterone, estrogen, or anti-androgens, the regimens, masculinizing or feminizing regimens that can be started at age of 16. And gender-affirming surgeries from 18. And hormones and surgeries intend to align body to what is socially expected for that gender identity. So the criteria for medical interventions are persistent gender variability, adequate management of psychological, social, or medical conditions that may interfere, caregiver support, unless their involvement is determined to be harmful or not feasible, and comprehensive assessment, including cognitive and emotional maturity to assent and consent. And this assessment is made in collaboration with families. Main issues in terms of medical care, the issues are on regret and detransitioning, which is rare, especially with good assessments, but may happen and require follow-up. Loss of fertility, often without access to preservation options. And puberty suppression, the long-term effects of puberty suppression on bone health, sexual functioning, and future surgical results. And the quality of evidence is usually low, but it's getting better. There's much more research being done. But we have to confront this paucity of high-quality evidence to an ethic issue that doing nothing is not neutral because of mental health consequences and social issues and potential irreversible physical changes. And of note, this group is one of the highest burdens of mental health issues like depression, suicidality. And from the human rights perspective, the understanding is that gender diversity is a variation within the human diversity. What are the barriers in healthcare? I'll give you a case study of Brazil. For some context, in politics, Brazil is considered by Swedish Institute VDM as an electoral democracy that is undergoing a process of autocratization, that means erosion of democracy. But long before the process of autocratization, there has been strong presence of conservative, neo-Pentecostal Christian groups in all levels in politics. In trans rights, right to name was granted by Supreme Court rule in 2018, and there has been unprecedented access and visibility of transgender people in all contexts of society. Culture, music, television, cinema, sports, and representative politics. Now, transgender people have places in city halls and state legislatures. But Brazil keeps being the top country on murder of transgender people. In legal framework, in 2009, the government issued the first Trans Care Act for only people aged 18 or older. In 2013, the Federal Medicine Council issued its first position on transgender adolescents, and the government issued a second version of that Trans Care Act, now including adolescents. But the next day, the document was reviewed and every mention on adolescents was removed. So it became again an 18 plus act. In 2020, the Federal Medicine Council issued a new resolution, more solid and comprehensive, on transgender adolescents and children. But in São Paulo state legislature, there was a law project aiming to forbid hormones to transgender adolescents. And that's happening in other places. The United States, since 2020, all these red states in the figure now have project of laws or approved laws banning trans-specific healthcare for transgender adolescents. So what can healthcare workers offer in such constrained contexts? There's something we can offer. We can move beyond this feeling of being powerless or resourceless. Well, first you have to understand our public. It's very diverse. Adolescence is a spectrum, so the poles are very different. When young adolescents show up to health services aged 10, 11, 12, usually they have parents with higher level of education and acceptance, are from higher resource settings. And there are more concerns from a medical point of view with regret or long-term consequences of puberty blockers. They will require advanced services, but they are rare in our day-by-day practice. For a part, I specialize in services university here. Most adolescents, transgender adolescents, will show up at older ages of 15, 16, 17, so they will have more consolidated gender identities, higher emotional and cognitive maturity, and maybe years of history of struggling with this issue. This history may include parental rejection, school dropout, and self-medicated hormones. They will need intermediate to basic services. They are the most cases, and you need to prepare, at least for them, and define a package of services that may include or not hormone prescriptions, basic without or intermediate with. That's a realistic view that in many places and contexts, hormone prescription will not be feasible because of different reasons: lack of national medical regulation, lack of support from the team of managers, lack of technical competence, lack of parental consent, or political constraints. So the services have first to be sincere with the family about our limitations and what are the perspectives for this to change. But we can offer validation of gender identity, longitudinal partnership, psychological support, social support, contact with school, community, social programs, sexual and reproductive health, and HIV care that will be more effective if address gender identity issues. This basic package should include also harm reduction for self-medicated hormones, counseling on choices, dosing, administration, and laboratory monitoring. What can other stakeholders offer? First, debate, avoid avoidance. Every event on adolescents' health should include transgender adolescents. Doing research and officially supporting transgender and gender diverse adolescents. Concluding, formal denial of health care to transgender adolescents is a violation of human rights. The suggested focused approach on older adolescents and no prescription doesn't mean giving up young adolescents, giving up prescriptions. It may be an alternative to offering nothing in constrained settings. For adolescents, that may be a bridge for the 18th birthday or a matter of safety. For healthcare workers, maybe opportunity to capacity building while better, easier times don't come. But for these easier times to come, stakeholders' action is required. So this is Last Pride in São Paulo. This flag says trans kids exists. Obrigado, Nkosi. These are my contact. It was a pleasure and honor to be here with you.